How's everybody doing today? So I just want to test everybody from last week's presentations, just making sure that everybody was awake while I was presenting. So let's say that you have a patient, a female patient in her late 40s who's experienced some diplopia, double vision, and ptosis, drooping of the eyelid, and she's also complaining of difficulties in chewing food. And she also has severe proximal lower extremity weakness and usually fatigue after 2 to 3 repetitions of any movement. And she also had a thymectomy 5 years ago, and currently she's also taking immunosuppressants. And aside from all of that, like 2 weeks ago, she also had a plasma exchange. So does anybody want to take a guess what this person might have? Caroline?
Myasthenia gravis.
Great. She was listening. Alright, so since we are in the physical therapy program, so I'll just focus mainly on physical therapy treatment for myasthenia gravis. So physical therapy is a secondary treatment for myasthenia gravis patients. But however, physical therapists play a very important role in evaluating muscle weakness and functional mobility. Usually the treatments are really conservative, and the exercise are individualized since every patient is different and their level of muscle weakness and fatigue varies. So exercise is only appropriate when the condition is stable under medication, yeah. And the exercise usually short in duration and of moderate intensity. And just some exercise are kind of ideal for myasthenia gravis patient are walking and stationary bikes, and also weight training. Just have to be aware not to fatigue the patient with overexertion. And also treadmill. Treadmill is good, but since treadmill is not a self-paced exercise, so you just have to be aware again not to overdo. And also swimming. Caroline will be very interested in aquatic therapy. So swimming is very good, but make sure the temperature is not extremely hot because that will cause fatigue. And also aside from the traditional physical modalities like e-stim and hot pack and stuff like that, therapists usually use relaxing superficial massage as well, because patients will have a lot of tightness in the body, so it's good to do some relaxing massage. Therapists also can teach the patients how to monitor the symptoms, like during exercise or at rest, or just doing daily activities. And that also leads to energy conservation, because it's important for them to conserve their energy so they don't, use up all their energy just doing, let's say, like waxing the car or something. As a therapist, it's imperative to remember that you should never exert the patient to the point of fatigue when you're doing the therapeutic exercise, because as we all know, fatigue is going to exacerbate their symptoms. So the prognosis for a myasthenia gravis patient is very good with effective treatment. And even though their quality of life may be compromised due to functional difficulties, but most patients are able to live their life independently. Here is just a site, Myasthenia Gravis Foundation. I find this really helpful. So you guys, if you want to find out more info, you can go look it up and participate in like future walks or something. Yeah, because for this year it just passed. It was in June, so I'm gonna plan to go next year. Thank you.